While wait lists to see a family doctor grow in parts of Ontario, a Toronto-based scientist is using TikTok to help people access much-needed primary care.
I just found a ton of family doctors in the greater Toronto area outside of Toronto who are accepting patients right now. I'm not talking about wait lists. I'm talking about getting a family doctor right now. If you want to know how many I found, this many, like a lot. Keep watching the space behind
This is
me.
real. Dr. Anna Durban called 100 doctors' offices to see if they're accepting new patients, and then created videos to point people in the direction of the ones who are. Well, she's had so much demand, she's now expanding the scope of her videos to include other forms of much-needed health care. Anna Durban with the Centre for Addiction and Mental Health is joining us this morning. Welcome. Great to have you here.
Thank you so much for having me.
First of all, why did you decide to gather information this way and then put it on TikTok?
Yeah, there's pretty big chasms in terms of how healthcare is delivered. Like, you have to be a pretty savvy navigator and a self-advocate to get the healthcare that we are actually entitled to as like publicly insured people who live in a wonderful province in Ontario where there's great health resources. But you have to know what you're actually able to get and how to get it, and that's not very easy, and it's not really well known.
You're going to talk to us about the process in a second, but out of 100 doctors' offices that you count, you found 85 of those 100 were accepting new patients. That surprised me. That's way higher than what I would have thought. Why are so many people finding themselves on wait lists when you didn't seem to have much trouble finding doctors who were accepting patients?
Yeah, so that's exactly sort of the key. The secret sauce to what I did is that I crowdsourced the information. I wasn't just calling like 100 random doctors' offices. It's probably up to about 200 now. But I went to all these different social media platforms. I joined about 200 local Facebook groups that have like really authentic content, not just people trying to sell you things. I went to WhatsApp. I just asked a bunch of my friends, and I was able to find a bunch of people who wanted to share information, like, I think my family doctor's accepting. I got this email yesterday. Okay. And then from that, I made a list. And that I created the list of about 100, and I called all of them to say, are you accepting family, are your family doctors accepting new patients right now? And that's how we put the list together. And so I know the information is really current.
I think it's really important to point out that this is volunteer for you. This is not part of your paid research that you do.
No, absolutely not. I'm a scientist at CAMH, which is like a wonderful institution, but this is something I kind of do when my 3 kids happen to leave me alone for a few minutes. And I'm just trying to put the information on social media because people are on social media and we're not sharing the information on social media. So I just feel like it's such a big gap.
You know, we've done this with other shortages in this province, whether it's parents that were looking for cough medication when there were shortages on the shelves, or vaccines, like where can I go and get a vaccine where it's not a long wait? We've done this before.
Yeah, and we need to keep doing it. This isn't like brain surgery. It's saying instead of putting information in a policy release or somewhere where someone's not going to look for it, put it where the people are in a way that people want to find it. Like, so if I could dance, I would be like dancing this information out, you know?
This next round of videos that you're doing is for mental health clinics and pediatricians who are accepting new patients. We know that there is a huge shortage, especially in like child psychology and psychiatry, for example.
Yes.
What led you to focus where you're looking now?
There's so much demand. So when I posted the list initially, first of all, I actually got more suggestions. So then I went back to expand the list. Then I got a ton of questions about expanding the geography. So can I extend it to Ottawa, to different places? And I have to say, no, my scope is Toronto because that's where I'm actually able to crowdsource this information.
Yeah.
And to really try to help people. Like right now, some of these autism assessment wait times are, you know, multiple years. Like,
yes.
Often you're waiting 2+ years for some of these publicly funded diagnoses. So,
and in autism, early diagnosis is key.
It's incredibly important. And waiting for the diagnosis, like when you think you have something like that and you're just waiting to get a formal diagnosis to unlock access to services, like that's crushing. How can you help yourself? You want that diagnosis so you can help yourself. So figuring out if we have all of these wonderful resources, and they're actually more available in some cases than people think. Autism is one where we really have a shortage, but trying to just match the supply and demand, and that's like with family doctors. If there are family doctors accepting, I can help create that match. Yeah, if there aren't family doctors or there aren't autism services, then it's harder for me to have a role.
Getting back to the family doctor situation, listen, I don't know about you, but I feel like this should be a paid position. If there is anybody in the provincial government that's watching, Jane Philpott's watching, or Doug Ford, or whoever, this needs to be a paid position. There's this huge gap between doctors who want new patients and patients who need a doctor, and you, on your own volunteer time, in between your full-time job and your 3 kids, are helping people find them. What is the solution to this chasm?
Yeah, I agree with you. I think it needs to be a full-time position because this information changes so quickly. But at the same time, I have 3 different examples of family doctors who posted on Facebook that they are looking to take new patients. I'm getting requests from like people at Sunnybrook and other clinics saying, we want to take patients. We don't know who doesn't have a family doctor, right? And that's a funny thing that we don't think about, but we need someone to help create the list of the people who are looking and then match them with the people who have availability. And I just think social media is such a wonderful tool for that.
We need like dating apps, but for doctors and not dating, just healthcare.
That's that's what I want to make. I'm like, people.
Anna Durban, thank you so much for the work that you're doing and for coming in your morning today. And best of luck with the new research that you're doing.
Thank you so much.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.